Hello, welcome to our latest Queen Elizabeth Scholarship presentation from the McMaster Health Forum at McMaster University in Hamilton, Ontario, Canada. I'll provide you with a quick rundown of the McMaster Health Forum, the Queen Elizabeth Scholarship Program, and the Queen Elizabeth Scholarship Program here at the Forum. I will then turn it over to our scholar presenter who will talk about their experiences. The McMaster Health Forum aims to be the leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders to act as an agent of change by empowering stakeholders. The Canadian Queen Elizabeth II Diamond Jubilee Scholarships, or QES for short, is managed through a unique partnership of Universities Canada, the Rita Hall Foundation, Community Foundations of Canada, and Canadian universities. This program is made possible with financial support from the Government of Canada, provincial governments, and the private sector. The purpose of the program is to activate a dynamic community of young global leaders to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. The McMaster Health Forum had a previous Queen Elizabeth Scholarship Program. We were very proud to have been selected as one of 20 Canadian institutions to host a second round of scholars. The new program ran from 2018 to the end of 2021, but was extended to the end of 2023. The focus of the McMaster Health Forum's current Queen Elizabeth Scholarship Program is strengthening health and social systems. Our scholars have contributed to strengthening health and social systems and have become part of our large and growing network of health and social system leaders. During our original Queen Elizabeth Scholarship Program, we hosted 14 incoming scholars, and we sent 3 outgoing scholars to work with our partners. We also had an additional 44 outgoing interns who traveled abroad to work with partners of the McMaster Health Forum. For our current Queen Elizabeth Scholarship Program on strengthening health and social systems, we have hosted 7 incoming scholars, and we have sent abroad 24 outgoing interns who have worked with our partners around the world. Our scholar presenter today is Erin. At the time of QES, Erin was a graduate student in the Master of Global Health program at McMaster University, specializing in globalization and equity. Erin's graduate work is exploring the intersectional health impacts of neoliberalism and transnational corporation practices on the people living in the global south. During her internship, Erin hoped to learn how to effectively integrate evidence and stakeholder insights into policymaking tools to support the development of sustainable and equitable health programs in Australia. Erin, over to you.
Hi everyone, my name is Erin. I am one of the Queen Elizabeth Scholars who interned in Sydney, Australia this summer. These 3 months have been enriching. I am so excited to share with you my experience learning about health policy and traveling in the land down under. I'll start with a summary of the academic and policy content that I worked on during my time at the Institute. So I developed an evidence brief on the value of dynamic simulation modeling in health policy and planning. And the reason for this was because this aligned with the current research directions of the decision analytics team in the Sax Institute. Many members are involved in various projects related to using agent-based models, discrete event simulation, and system dynamics in health policy. And one example of community engagement involved with this project would be participating in stakeholder meetings. So I remember there was a stakeholder meeting where the decision analytics team, including myself, we met with a clinician and research representative from Westmead Hospital to build a discrete event simulation model. This project would model patient flow to reduce queues in the PICU, so the pediatric ICU. And it was really during this experience where I learned about the nuances involved in model development. Such as recognizing that hospital resource availability changes along with patient flow, and this should be accounted for in the coding process when we're developing the model. And the biggest challenge and perhaps the most important issue here was accurately modeling patient arrival. We had to consider the frequency, type of condition, and type of treatment, all of which would affect the length of stay in the ICU. As well, retrieving access to the 6-year data had to be coordinated with the hospital officials. And I was overall very grateful and satisfied with the opportunity to participate in these PICU stakeholder meetings. Just a little bit related to my master's. During my Master's of Science Global Health program, I learned on paper what an effective and inclusive stakeholder consultation should look like. And this internship really allowed me to witness firsthand the complexity, challenges, and importance of consistently integrating stakeholder input when building a model for health planning. I developed skills with the support of the decision analytics team at the Sax Institute, and these included preparing proposals, conducting research, and preparing policy documents and reports. And I also strengthened my communication skills. I learned the importance of being transparent when clarifying team understanding and expectations for collaboration projects. So, for example, when I was drafting the manuscript for my evidence brief, my supervisor and I actually had different visions and ideas on the structure and content of our document. So what we did was that we shared our perspectives and rationale with each other, and we really listened to what the other had to say. So I initially prepared a lot of data on the limitations and next steps of model application. And she suggested that the bulk of the document should be on the specific values of what each complex model offers. And so after this back and forth, we accepted each other's constructive feedback, and we continued to ask each other many questions for clarification. And in the end, we were able to reach a consensus and successfully move forward with a revised and robust work plan. There were many opportunities for networking as well. I networked with people with computer science expertise, for example, simulation modelers and programmers. I learned from the decision analytics team model developers and programmers that during stakeholder consultations for model building, a significant challenge was the varying levels of understanding of model complexity between them and the clinicians or public health representatives. So through these networking processes, I also learned a lot. And I learned that it was tricky to navigate between deciding which aspects to prioritize in the case of interest and what was practical, what was possible with modeling. For myself, coming from a science background, it was fascinating for me to realize that the language and ways of thinking practiced by computer scientists can be largely different from those with health providers or professionals. And more on networking, the team that I worked with, the decision analytics team, this consisted of brilliant individuals with diverse expertise and background, ranging from research officer, simulation modeler, ICU nurse, etc. On Wednesdays, when many staff members were in office, I was able to network with colleagues from other teams such as Evidence Connect and Indigenous Research. And finally, the Sax Institute, they really did a great job facilitating these networking opportunities, especially when we just arrived. So upon arrival, the Institute hosted a welcoming party for the McMaster scholars in the company kitchen. Members from all departments were invited, and refreshments, including Australian delicacies such as Tim Tams and lamingtons, were provided. We really felt warmly welcomed, and we were able to quickly familiarize ourselves with the company within the first few days. And my team and I would meet every Monday to share our work progress and recent life anecdotes. Often I would talk about my weekend tourist activities, and my colleagues would share updates about their family. My supervisor and I would meet every Wednesday to do the same, with the conversation tailored more to my work track during the internship. My team also has occasional organized team lunches, and our favorite spot was always the ramen shop that was close to the office. Working at the Institute has really been a bi-directional relationship where I learned a lot in terms of also increasing my awareness of the challenges faced by local and global communities, and my work has also strengthened the capacity within my host institution. So in terms of increasing my awareness of global challenges, as I was screening and extracting data from studies related to modeling health policy cases, I was exposed to various challenges faced by policymakers in local and global settings. For example, the findings from complex modeling such as discrete event simulation has mostly been implemented in health facilities in high-income countries as of 2023, with scarce examples in low and middle-income countries. Many scholars would suggest that future research should consider the application of health modeling in LMICs to improve the policymaking process. And the evidence brief that I wrote during this internship, my supervisor and I have discussed about how this can help strengthen the capacity of Sax Institute. So my brief focused on the value of dynamic simulation modeling in health policy and planning, and so this internal document serves as a support tool for the staff of the Sax Institute to consult when they're working on public health projects. This brief provides an overview of the current landscape, advances, and next steps related to using agent-based models, discrete event simulation, and system dynamics in policymaking. This document also has the potential to be shared with the partners of Sax Institute, as it is readily comprehensible for both beginners and experts in the field. All right, and as for the cultural and travel content about my experience in an entirely different country, my time spent in Sydney, Australia, or in Australia in general, has been eye-opening and exciting in terms of connecting with the locals. This would include colleagues at the Sax Institute or baristas in cafes. We really connected about the culture, the ways of life, and interesting Australian jargon that I haven't been exposed to in Canada. Australia offers innumerable travel activities ranging from Bondi Beach, Sydney Opera House, Blue Mountain, and the list really goes on. The other QES scholars and I have become close friends during this internship. Aside from working in the same office, we would enjoy a lot of our downtime, like weekday nights or weekends together. And a few examples from the many would include trying out new restaurants, going to the beach, hiking, heading to the theaters, and visiting local museums and libraries. It's really the QES scholars, the other QES scholars, they have really made this scholarship extra colorful and extra memorable for me. During my time in Australia, I also learned two important lessons. So number one, when collaborating and connecting with a diverse team where members have different cultures, backgrounds, and lived experiences, I learned to balance between being proactive about sharing my thoughts while attentively listening to and respecting the perceptions of others. I learned that we all have so many things to offer each other, and being respectful is paramount, and it really allows everyone to absorb a plenty based on what we're learning and the goals that we're trying to achieve together. And aside from the enriching working experience, this internship also allowed me to have a robust work-life balance as I immersed myself into the beauty of Australia. In Australia, I adopted the habit of, after working in the office on the weekdays, I devote my attention to relaxing and doing things I enjoy on the weekends, like hiking along beach trails and reading in a coffee shop. With fully recharged batteries, I was able to head back into the office on Mondays with high spirit, motivation, and productivity. Simply put, Australia has taught me how to live life more fully, and upon returning to Canada, I have been more mindful of adapting my work-life balance in my daily routine, as this QES experience has truly made me a happier individual. I like to end this presentation with my main takeaway from the summer. It's the importance of exploration, doing something that you're not familiar with and absorbing from it. I spearheaded an evidence brief on a topic in which I had no prior knowledge or experience. And so at the Sax Institute, there was an initial steep learning curve for me to become familiar with how dynamic simulation modeling works, including learning concepts like optimization and model validation. To fill in this gap, I read extensive literature related to the field and often consulted my supervisor or team members when I had questions. And I was able to successfully complete data screening, extraction, and manuscript write-up for the evidence brief. And this internal document now serves as a support tool for the Sax Institute. And so I'd like to give my gratitude to the McMaster Health Forum, the Sax Institute, as well as having the opportunity to receive the Queen Elizabeth Scholarship and to really have this life-changing experience this summer. Thank you for listening.